We recommend standard American Cancer Society screening, colonoscopy every 5 years, gynecologic examination for women. We recommend the PSA, even though it's not generally recommended anymore for the non-transplant population, recommended for transplant patients, because if prostate cancer occurs in transplant patients, it's more aggressive. We have a transplant dermatology program here, so we do recommend screening for squamous cell carcinoma, but even more important for melanoma, which can be absolutely lethal. One thing that we have not kind of reached a consensus on is whether to do CAT scans to look for lung cancer in smokers. And that's still kind of controversial in the non-transplant population, but it probably makes sense to do it in transplant patients because they are at higher risk. If you pick up lung cancers early, you can treat them and cure them.
Would you say that's your general philosophy? Catch these things early and they can be treated?
Absolutely. The earlier you catch them, the easier it is to treat them and cure them. Melanoma, for example, although it can be a lethal disease when it's metastatic, the vast majority of people who are diagnosed with melanoma in the United States are cured because it's just a localized area that is removed.
Any other general advice you give to any transplant patient friend of yours as far as they've just become aware of the higher risk? What would you say to them?
Just, undergo the standard screenings. You'll likely be sent to a dermatologist, follow up with them for close follow-up. And just be cognizant of the fact that malignancy is one of the 2 leading causes of death beyond the first year post-transplant.
So does the risk of cancer grow years post-transplant and also with age?
Well, the risk of cancer grow with age for everybody. The sum total of immunosuppression that you receive increases the risk of cancer, so it also increases with how many years you are post-transplant. If you look at the curves, they all increase.